Hey everybody, welcome. My name is Landon and I'm from FIT. FIT is software for high performance coaches. And we are really excited today. We're going to hear from Jamie Jagger. And I'd like to give you just a quick, um, sorry, um, I just lost my intro for Jamie. But Jamie is at a certified athletic trainer at University of St. Thomas, and previously it was she's been with Hamline University and Oregon State University.
Oh man, no, I'm a duck.
Oh,
University of Oregon.
excuse me.
Just
Excuse
kidding.
me. I had that on there. Jamie, I'm so sorry.
It's okay.
But Jamie is, we're super excited to have Jamie here with us today. She's going to talk to us from the AT perspective and kind of tell us maybe how the athletic trainers and the strength and conditioning coaches can all sort of get along, right? Work
Yeah,
together.
yeah.
Excellent. Well, Jamie, thank you for being here, and we're just going to turn it right over to you.
Okay, awesome. So I'll just share my screen here quick. All right, so can we see that? Okay, awesome. Well, thanks for the introduction. So I was asked a while ago to kind of speak on the integration between sports medicine and strength and conditioning and how that relationship can foster and enhance just the overall athlete care. So I do feel pretty passionate about this. And I try to value this in my day to day because I just feel that, well, one, I've been able to learn from fantastic mentors I've had in the past and see how a team can collaborate and how effective and vital that is for an athlete to reach their goals and really just to give them the best environment to heal from an injury or just enhance their performance. So in the past, I feel like traditionally it's been easy to view sports medicine in its own silo and strength and conditioning kind of in its own silo, where sports med focused only on injury and rehab, while strength and conditioning emphasized performance. But I do feel like the world has been shifting or is already there and has realized that that synergy between the two is a better approach for comprehensive care. So I'm going to kind of surround my talk around that. I'm going to start with kind of going over some role delineations of an athletic trainer and use this opportunity to explain some of the domains of expertise, elaborate on how they can overlap and the distinction between the two professionals. And then we'll focus mostly on the return from injury and how we can collaborate together, or at least how I try to do it here. So I know, Landon, you kind of already gave a little bit of my background, but I did want to touch base on each spot because I do feel it's important to understand where I'm coming from and where my opinions and how they've been shaped. So I've had my fair share of collaboration with multiple different professionals, but I've always valued that relationship between athletic trainer and strength and conditioning coach. I've seen the good, the bad, the ugly, you name it, at all the different previous institutions I've worked at. But I started at the University of Stevens Point, and I played basketball there. I only share that to say that I do have a unique perspective of being a student athlete and working with both parties. Um, then I went over after I sat for my boards, got my athletic training degree, and I went to the University of Oregon. A lot of resources, a lot of technology, a lot of moving parts. And so being able to figure out how all those people can work together was super crucial for my career moving forward. Then I moved back to the Midwest and went to Hamline University, which is the complete opposite of Oregon, where there's not a lot of resources. It's a small D3 liberal arts school. And so you have to kind of figure out still how to foster the most out of both the strength and conditioning coach and the athletic trainer to give the athlete what they need with those limited resources. And now, like he said, I'm at the University of St. Thomas and work with men's hockey and men's and women's golf. And we have a great system here with the collaboration between strength coach and athletic trainer. And so hopefully I can kind of share some of what I strive to do here at UST, and what works for my setting. So with that being said, you guys and your values and education background are going to vary from mine and create different frame of reference. And I actually think that's a good thing. And that's kind of what my talk is about, to be able to find that value in everyone and have those conversations when opinions do differ. Um, so like I said, I'm going to start briefly going over the profession of athletic training and our domains of expertise. I think as professionals, it's important that we understand our our background and kind of where we're coming from, because it can eliminate any confusion from the start or any distrust. It's always useful to talk about this with who you're working alongside of, just to be able to gain a little bit more of a shared language and understanding, which is crucial for collaboration. So like I said, we have 5 domains. I'll run through these pretty quickly, but not only to take the opportunity to explain what our profession does, because I feel like that's part of my job, but also show you how much overlap there is. So not just with strength and conditioning, but really a lot of other disciplines. The first domain being risk reduction, wellness, and health literacy. This is fancy wording to say that we're promoting healthy lifestyle behaviors and being able to create effective communication to enhance overall wellness and minimize injury risk reduction, or minimize the risk of injury in our student athletes. So we're trained to do pre-participation assessments, movement screens, identify risk factors, review medical histories, allow us to have some understanding of workload monitoring, and then how to implement plans applicable to what we find in that specific athlete. We're also should be aware of our epidemiology of the specific population we're working with, and also intervene when necessary there too. On top of that risk reduction, we should also hold ourselves to a standard to promote that healthy lifestyle and environment. We need to be aware of the social, the spiritual, mental, overall intellectual wellness, in order to advocate for our athlete and educate not only them, but our coaches, our legislators, our communities, and unfortunately, sometimes even parents. So I think that this domain overlaps a ton with strength and conditioning, because depending on the level you're at, there are so many ways that the two of us can work together to advocate for risk reduction programs, wellness screens, education sessions, opportunities to do some injury tracking, and so much more. So an example of that would be, let's say you're at a high school and maybe the athletic trainer doesn't have as many touch points as the strength coach does prior to an injury, just based on the load of the athlete. But that's a chance to discuss epidemiology of certain teams you're working with and how exercises can be implemented in the weight room. Or you're at the college level and you have more objective baselines that strength and conditioning coaches can monitor and help bucket athletes, and athletic trainers can add to that by providing a previous injury history that we can make ahead of time so that we can get ahead of those injuries. And then also just creating like a safe environment. So if you do have those workload monitoring tools, that's awesome, but also a safe environment for the athlete to feel comfortable coming to not only the athletic trainer, but the strength coach, and the two of those people being able to communicate any concerns that come up ahead of time. And I have a social media thing on here because, as you know, athletes get a lot of their information from social media, whether it's good or bad. And so if the athletic trainer and the strength coach are on the same page to debunk some of those myths and encourage safe habits and safe resources, I think that is very beneficial. With that being said, I do think there sometimes comes the differing of opinions from a social media debunking, and taking the breath to understand where that other professional is coming from and what their expertise is, and maybe trying to learn a little bit from them before you just say to the athlete, well, that's wrong, don't listen to him or her, etc. Because I know that happens sometimes. The next one is assessment, evaluation, and diagnosis. And obviously this is where our athletic trainer's bread and butter is. So this is where we spend the majority of our time. We're able to triage, we have to formulate an injury, create differential diagnoses, from right off the sideline to maybe a chronic issue or whatnot. But once diagnosed, we should have the first few steps for the athlete. Are we sending them to a physician? Do we need imaging? What does the practice participation look like? What are the weight room restrictions? And how can we create like the best healing opportunity for that athlete? This is crucial to collaborate with the strength and conditioning coach, especially in the setting that I'm in. I can argue that the strength coach needs to be one of the first to know after an injury happens. I have an sample injury report up here on the way that I utilize things to be able to provide information. But if you don't do it formally like this, at least a conversation, so that as long as the athlete has signed the appropriate release of information, obviously. But I can argue that this allows the strength staff to be able to adjust a plan, make modifications to certain exercises for the appropriate amount of time. And also they should be a part of the plan of care, as I'll go into later in the presentation. The other thing with injury assessment is that most of the time after a mechanism of injury or an athlete reporting something going on, we as athletic trainers should have an idea of like 2 to 3 things that it could be. And why it's so pertinent to discuss with the strength coach is, did they see any compensations in the weight room? Did they complain of anything to the strength and conditioning specialist? Do they know of any other outside workouts that they're doing? Have they said anything extra to them? Does the athlete come in and are they doing any outside work with the strength coach that maybe the athletic trainer doesn't know about, or that the athlete maybe thought wasn't a big deal? And these questions are never meant to accuse or challenge the strength and conditioning coach, but they're only to gain more information so we can make a better and usually quicker diagnoses. The third domain we have is critical incident management. So this is our emergency action planning. We should be prepared to react and respond to a variety of emergencies, from cardiac to heat illness, et cetera. And as athletic trainers, we have a responsibility to keep everyone safe and identify and use those standards of care to prepare for them. So we should have an emergency action plan for all the venues we work out of. We should be able to guide the roles and responsibilities for the people that are going to be present during an emergency. And so we should have that talk. All athletic trainers and strength coaches should be CPR and AED certified. So at some point, you should run through some type of practice scenario on how you're going to handle a situation like this with your team. The last thing you want to do is be confused or have an argument in an emergency situation. So the athletic trainer should really discuss the location of emergency equipment, the EMS location, the overall emergency action plan, and organize some type of practice session. And if that's not being done yet, then that's okay to go ask the athletic trainer, what is the emergency action plan for the weight room? Or what is the emergency action plan for this venue if I'm here at a game? I think that's completely appropriate. The next one is healthcare administration and professional responsibility. And I laugh here because there's a literal task description in this domain that says athletic trainers play an integral role within an interdisciplinary team, collaborating with other professionals to provide evidence-based care. So the title of my talk is legit a component of our education. So in my opinion, there's really no excuse to not be working as a team. We have to communicate with physicians, with physical therapists, with sports psychologists, with dietitians. So I don't see why communicating and collaborating with strength coaches is any different. And in fact, a lot of our current master's students that have been coming in and out of programs right now for athletic training, their focus has been research and surveys to identify ways to foster that interdisciplinary team. And it's been kind of interesting because they've done a couple sample pilot studies with our teams, and just finding the small things through a survey that can better your collaboration actually makes a huge difference. And it might be something that you've really never even thought about. So if you want more information on those types of surveys, like, we can talk about that offline. And then the last thing is that therapeutic intervention. So rehabbing individuals with a health condition, whether it's injury, illness, general med. And this is where we use therapeutic exercises, modalities, manual therapies. And this is the domain that we spend most time working together, and where I'm going to kind of discuss the return of an athlete and how we can elevate the student athlete's experience through both healthcare professionals working towards a return from injury. So these next slides kind of discuss my opinion or outline of what a return from an injury should ideally look like, and how the role of each professional differs based on the stage that they're in. So I know every injury is different, timing of goals, where you're at in season, it might affect this. So this is just a general continuum after an injury and how I try to guide our athletes. So as I pull this up here, you'll see I don't really have any defined milestones or true official like handing off to the next professional, because I really don't believe in rehabbing stopping and performance training beginning. I think they overlap a ton. So I don't really like thinking of it as handing off a baton. Rather, what healthcare professional is the quarterback of that stage? So who's leading the phase, and how are the rest of the professionals assisting and still involved and monitoring progress or lack thereof? And I've got to give credit where credit's due. I got this from a huge influence on me, Sue Felsoni. She's a huge female leader in the sports medicine world. But I really just like this metaphor, and I think it just makes complete sense. So as we go through this continuum, it starts as soon as the injury occurs, or post-operative after a surgery. This stage is the first few days to weeks after an injury. We're considering pain and swelling, bracing, casting, surgical indications, those kind of things, and respecting the physiological response to an injury. Then when they're more stabilized and returning to daily function, they enter kind of the return to participation phase. So this is where they're able to start some training, mostly in rehab sessions and sometimes in the weight room, but they're not really ready for full training yet. Next is the reconditioning phase. So this is the transition that I like to think of the focus on the injury to the focus on the athlete and the true foundation of strength and conditioning for that athlete. Then we move to return to sport. This is when things become more sport specific to what activity they're returning to. So collaborating on ways to have more sport specific drills, adding in a strength coach, enhancing their athletic capabilities. They're probably returning to some type of practice here as well. And then the last phase being that return and continued performance. So they're probably back to full practice. Maybe they've competed in a game or two. How are we working together to continue going back to that first domain I talked about reducing that risk of re-injury? And then as you can see, I have a bilateral arrow down there because just like a lot of our training, nothing is linear. You can move forward, you can go backwards. You could be technically in the return to participation phase, but doing some return to sport activity. So again, it's very fluid. And inside of that bilateral arrow, you can see that there's a ton of other factors that always need to be considered throughout the entire progression that we know can affect how an athlete heals. So the first stage is this injury stage. So obviously, what's getting the appropriate diagnosis? Athletic trainers should be experts at this stage. They kind of take that first quarterback role. After an injury or surgery, we should know like what's the pain generator, what the healing tissue times are, and those types of things. So we should be able to identify acute treatment intervention, what normal tissue healing responses, and respect those physiological responses to injury. This is extremely important and helps reduce the chance of them having to go backwards on the continuum, that we respect these first few stages of wound healing. So we have that first bleeding or hemorrhage and how we use protection and support as needed. So are they braced? Are they in a cast? What medication are they using that can affect their healing? We need to give the body time to go through this stage, and that's usually in the first few to 24 hours. Then inflammation is an important response in this stages of healing. And after injury, the athletic trainers should help foster and control this as much as possible. It's vital that they go through this stage, bring cells to the area to help remove damaged tissue, but it should be relatively short-lived. So this initial phase, if it's not appropriately cared for and given that amount of time, it's hard to get past, and we can create like kind of the start of some of that muscle guarding pain spasm pain cycle, which is super hard to get out of. So as an athletic trainer, how are we addressing pain? How are we reducing the chance of inflammation and stiffness? And how can we communicate post-operative considerations? How do we start stressing the tissues appropriately? And how do we guide the appropriate exercise selection? So those are all the things that the quarterback of this phase, which is the athletic trainer, are going to do here to avoid falling into this pain spasm pain cycle. As you can see, if we start with pain and we don't allow that injury to heal, we're going to get muscle guarding, restricted mobility, and then the whole continuum moving forward will be affected. Here, the goals of the athlete is important to be discussed between the athletic trainer and the strength coach. So this is realistically kind of the starting phase and how we can plan every stage as we move forward. And what does the athlete want to get back to? Where are we in season? What's the timeline? We can also start to tie in other disciplines here to create a healing environment that's best for the student athlete. When we all get on the same page, so adding in nutrition interventions, maybe a sports dietitian, getting our sports psychologist on board for someone that may be out for a long time, and our strength coach starting to help plan the rehab, and then our athletic trainer guiding that first couple stages, that athlete is going to feel so supported right off the back. Then as we enter the second phase, which is return to participation, this is where they can start participating in active daily living, maybe early stages of rehab, but like I said, they're not quite ready for full training yet. So this this phase is kind of QB'd still by the athletic trainer, but we start to move into the strength coach helping us with that general aerobic conditioning. So getting them around the team. Maybe they can't do running or jumping or anything like that yet, but we can get them on a bike and be in the team lift. We could have them do a modified version of some type of GPP, as long as it's obviously safe for the athlete. So also in this phase, I think this is a great opportunity to develop the athlete. What has been their injury history before this one? How can we determine why this happened? Let's look up the joint. Let's look down the joint that's injured. Let's look at any dysfunctions. Do they need to be fixed? Is it beneficial for the athlete to fix that? Let's have a discussion surrounding the tools and trainings that each discipline has to help with those types of things. So maybe you have a fascial manipulation, maybe you have a FMS screening, maybe you have a range of motion, like a functional range of motion certified, maybe you're dry needle certified. Like, what is the appropriate uses of therapies at this time? Getting them this like goal to focus on will improve their mental health. Getting them a part of the team will improve their mental health. And as we know, that mental wellness is a crucial aspect of returning from injury. And then lastly in this stage, get the athlete in the weight room, maximize their potential as soon as it's safe, get that uninvolved limb going. Let's not fool ourselves when we're chasing symmetry if we're not training the limb that's uninjured. Have the discussions with your strength coach on how we can get them involved. If they're in a boot, if they're on a scooter, have them sit down and do some upper body stuff. If they're in an arm sling, have them do some lower body stuff that's safe. There are other limbs to continue gains on, while at the same time, we can start to consider those injured limbs and what is the basics that we can start at to help reduce atrophy of that limb. Then we go into the reconditioning phase. So as I stated before, this is kind of the transition from the focus on the injury, where we're more isolating the injured leg, maybe with some isometrics or single muscle groups, to more of an athlete as a whole. So this is addressing the foundations of strength and conditioning. Athletic trainers and strength coaches need to be communicating about the injured athlete's plan here, so they're not overloaded or underloaded, really. Now, athletic trainers do have a general knowledge of how to progress load, apply different strategies for hypertrophy, strength, or power, and periodize rehabs. But strength coaches, this is your bread and butter. To me, this stage is QB'd by you guys, and with support from the athletic trainer for maybe any restrictions or modifications, or maybe there's a limitation from surgery that they can't do until a certain timeline based on the tissue healing. But it's important for this stage that we determine what are we training for? What are our goals here? And then as we continue going into here, how are we loading appropriately and progressively after we feel like they have gotten some of those basics? Loading parameters for athletic trainers, I feel like we fail at this. We don't do very well. We fall into that 3x10 slow and controlled manner, which can be necessary at the start, and then that return to participation phase, but that is not what an athlete only needs. We can change their load through number of reps, time to failure, time under tension, tempo. What are we doing to gain hypertrophy? What are we doing to gain strength? How are we turning that strength into power? How are we applying that power? And depending on their activity, like what do they need more of? So this is when athletic trainers really need to lean on the strength and conditioning specialist to help develop not just the injury, but the athlete as well. So how many times have we heard during this phase, can an athlete do this? Can the athlete do that? No. Can the athlete do this? No. Can they follow this? And just kind of going through exercise by exercise. And to me, that's kind of a waste of time. And I think that you need to communicate with your athletic trainer and your strength coach on common language about exercise selection. So being more specific in what an athlete's abilities are or their limitations. For example, if you say, oh, hey, can he do an overhead dumbbell press? Instead, say he can do any upper body push in the vertical plane. That just opens up more opportunity, creativity, and flexibility for the strength coach to choose exercises when communicating some of those restrictions. A quote that really stuck with me for this phase is, underloading in rehab can cause overloading in performance. And I just think it's important that if you're in a setting that doesn't get that daily communication like I do, we as rehab professionals need to prepare the athlete for the weight room. and the field. And it's important that the strength coach as well identifies what they have or have not tolerated before moving too fast or doing exercises that they're not prepared for. And in that same breath, we also don't just want to add volume. Sometimes we can get stuck in this phase where athletes during this phase are doing prehab and rehab exercises with the athletic trainer. Then they're going to the strength coach and they're doing the same thing. Maybe we're loading the quad way too much, but if we're not talking about it, then we don't have a great progression for them. So like I said, one last thing that I want to point out in this stage where I do also think it gets fuzzy is how are we monitoring that progress or really lack thereof? Are you taking into account objective measures? Are we doing are we considering the athlete body mass or the loss of that during the injury? Are we monitoring the recovery period? How are we guiding this this progress besides just like following a plan? So checking in, make sure we're discussing a recovery plan with our athlete during the stage so that they're able to adapt to those changes. Maybe there are in some of the lifts, but they're modified and have an extra day off or a recovery day that they can add in, just so that we're not making any detrimental progress. As we know, athletes, they just always want to do more, do more, do more. And so we got to make sure that we just plan in that recovery so that we avoid them doing too much. And I also put on here a great guide to help kind of watch this is that pain and swelling. So are we having that post-exercise swelling that you can work with an athletic trainer with some tools on how to identify that and set up some modalities and time off and ways to measure that. But we can kind of use that swelling as pain as a speedometer for recovery and progression. The next phase is return to sport. So return to sport for me is QB'd by the athletic trainer and the strength coach. We're kind of working together here to address advancing those fundamentals from what we did before, establishing more athletic capabilities. So what do they need to be, what needs to be enhanced for their sport? Are we adding in some planes of motion, different planes of motions, working on speed, change of direction, plyometrics, reestablishing, like I said, their athletic capabilities? Now, when I say sports specific, I don't mean you need to be standing on a physio ball, shooting a basketball with a band around her knees, but I do think that we got to have them do their sport. So if they can get out there and ball handle or shoot or stick handle or do some form work or whatever in some capacity, then that's a way that we can work them back into practices so that they're feeling comfortable. And that's what they want. They want a ball in their hands or a stick in their hands, whatever implement they're working with. And again, another way to have one of the phases be earlier. If they're still on a scooter, maybe they are doing some ball handling, those kind of things. And then, like I said, in the weight room, we're just addressing those sports specific development. Also in this phase, progression into practice is really important. We can utilize a skills coach for some of those sport fundamentals. Who's running their warm-up prior to practice? Are they involved in the full team warm-up? Are they still doing a couple extra things with the athletic trainer beforehand? We kind of just need everybody, including the skills coach, the head coach, the strength coach, the athletic trainer, to be on this plan of reintegrating back into practice. And then we need to stick to it and make sure that we hold everybody accountable so that we progress only as necessary and not too quickly when it becomes too chaotic. And then how are we addressing what they don't get at practice? So maybe they're jumping in a few drills, but they're not doing the contact drills, or they're not doing full ice drills, or they're only doing half ice drills or something along those lines. How are we addressing the extras that the rest of the team is getting that they are not, so that they can come up to that phase to participate in a full practice? And then the final pieces here as you return to sport, adding chaos. What are they missing? And this, when I say adding chaos, I know we can never mirror exactly what a game intensity or a full practice really looks like besides participating in full practice, but we can start to introduce some chaos and randomness to the exercises that we're already doing to prepare the body and brain as much as possible to be able to react and respond to things. The strength coach I work with right now does a fantastic job with this, adding this into their warm-up drills, whether it's games, what kind of games can they participate in that's safe for the athlete, and as well as doing some maybe extra vision work or just in general, adding some randomness to not so much of a structured plan. And then the last phase I have here is return to and continued performance. So this last and final stage should be continuous for the remainder of the season. So depending on the strengths and expertise here, workload monitoring can be key. So how do we as strength coaches and athletic trainers backward plan their load as they return? You don't have to have a ton of huge fancy technology, although it is nice to have that. But you can do something as simple as time and rate of perceived exertion, mileage covered. But if you do have that technology, you can do a further analysis of workload so that we're not going too much too quick as we reintegrate back into practice in full game. And so we can reduce some of that re-injury rate. I also think it's important here to consider all the stressors. So for example, if the athletic trainer and strength coach aren't collaborating and they could be getting an extra lift in, or they're doing an extra rehab session, we could be putting more strain on the body that's necessary. And I just think it's important that we continue to plan that recovery piece as we look at how much workload they're getting. And then both parties should constantly be reassessing the athlete. I think it's important whether that's monitoring swelling, like I discussed before, as they get back to full performance, or maybe the strength coach is doing force plate jumps weekly or some type of hip abduction, adductions testing weekly. Are we keeping an eye out for that person? Are we doing extra range of motion tests to monitor throughout the season? And as we assess those things, how are we working together to help reduce the risk of this re-injury? We should be communicating those pre-lift pillars, or if it gets directly inserted into their weight room plan, what kind of pre-ab exercises should this person continue to do without adding too much to their plate? And then, as I said before, the strength and conditioning coach and the athletic trainer are around the athlete the most and usually know the athlete pretty well. So are they psychologically ready to compete, or is something holding them back? So as a strength coach, are you having conversations with them? As an athletic trainer, are you doing a survey that maybe shows that they're not quite mentally ready? That should be communicated to both parties so that we can refer back to those goals we discussed in phase one as we move forward. So really just listening to the athlete in this stage, adapting if you need to, and starting to use some of those expertise. Maybe you have some extra credentials that are safe for the athlete at this point. So as you can see, the return of this athlete to continued performance can have many moving parts, but I think if all of us work together along the shared continuum and we all have a place where our expertise can be fostered and encouraged versus like one person taking the reins and controlling, then we can really keep it pretty simple for us. You'll notice that throughout this phase, maybe you as an athletic trainer or strength coach notice that you have a weakness in one of the areas, but I think it's an obligation really to create the professional relationship with someone that has the strength of your weakness. So you really help yourself and the athlete. So I quickly will just go through just a case study of how one of our athletes from start of injury to right now going into that return to performance phase. We had a men's collegiate ice hockey player, 22 years old, with no previous injury. He kind of got tied up. You can see in that red circle, his ankle is not facing the right way in the middle of the game. And he ended up having like I said on here, a spiral fibular fracture, deltoid ligament disruption, and a syndesmotic disruption. So we gurneyed him off. Again, that critical incident management. This injury phase was taken care of appropriately. Everyone knew their roles and responsibilities, and he was carted off the ice and had surgery the next day. So I realized that I don't take enough pictures, so apologize if I only have a few pictures of some initial stages and some videos that I borrowed from some strength coaches here as we move forward. But in this injury phase, he was casted for 6 weeks on a scooter. He needed to give time for the surgery to heal, right? So we're looking at how long does it take that fracture to heal? What surgical interventions do we need to pay attention to? How are we contributing to decreasing his pain and swelling while he is resting there? And then also during this stage, we're discussing goals. We're talking with our dietitian. We're offering sports psych if needed. And we're going through that, respecting the healing of that first stage. Then we moved into that return to participation phase. So some of these pictures are pretty early and some of them are pretty late, but I'll get into them in a second. But as you can see, yes, his cast may be off. Yes, he's moving to a boot, but he still has weight bearing restrictions. He still has some of his sutures are still in there. You can tell his leg is pretty atrophied. So during this time and a little bit before as well, when appropriate, we are starting BFR to reduce that atrophy. You can tell on the picture on the top left, that was right after the boot was, or the cast was off. And then the picture on the right, that was probably like a week later. And we're starting to make gains already, which is super exciting. So during this phase, we're still paying attention to that injury healing process. So we're respecting the limitations of dorsiflexion for this ankle injury. We're transitioning to a boot. We're starting to load weight bearing, but we're not able to completely walk yet. How are we integrating them into the weight room? We were doing single leg activity. We are having them seated upper body work. We were doing base level cardio. And during this whole phase, unfortunately, setbacks happen, but on that bottom left picture, you can see it looks pretty nasty. But that's a way that we can monitor progress. He had a suture abscess infection, which set him back a little bit. So we need to respect that. Athletic trainer jumps in. We take care of that appropriately. We pause on maybe some of that return to participation stuff, and we regroup. Then we can move on to the next phase once that was taken care of. Luckily, this was easily solved with some antibiotics and removing the suture that was causing him some issues, and then he was able to get right back to it. This is where I realized I don't have many pictures, but in the reconditioning phase, this is just a real quick example of one of the team lifts that we were doing at this stage. And luckily, timing worked out, and we were able to kind of work with the team during the off-season lift, which allowed for more of a easier progression. We had some we were kind of in that GPP phase, and we're able to make modifications here and there based on what he needed for that injured leg. Now, the strength coach and I were talking constantly about his progressions of load that might be slower than the team, what kind of things he can handle versus plyometrics, where we're at in the rehab phase, and kind of what restrictions he still has. Let's see if I can get this here. Okay, I guess it's not showing up, but that's okay. Oh, there we go. Okay. I don't know why that wasn't working. As he was in this reconditioning phase after the team lift, after he was with the team, he went back to a different gym just based on like area and timing of this school year. And this is a great example of how maybe I don't have that day-to-day communication with him, but he's still doing things. I'm calling the strength coach that's at Velocity to be able to communicate, like, he can start this, he can do this. So these are just sample videos from him just getting into straight line running, some resistance running, getting him back to sprinting, jumping, etc. And we're keeping pretty double leg, straight line, as you can see here. So we're still kind of in that fundamentals, basic foundations. Then we moved to, he came back with the team, which was, again, this timing just really worked out with like some of the team training, but we're in that return to sport phase. So we're starting to add in some athletic capabilities. So we're starting to do some single leg power development. We're starting to do some change of direction. And again, thanks, Corey, if you're on the call here for some of these videos, but we're starting to add some of that chaos and get a little bit more specific to what he needs to be able to do for his sport. Also in that phase, we're starting to add in some of those sport specific skills. So he's working on some, this is a little bit earlier in that reconditioning phase, but he was working on some double leg shooting and stick handling before he was able to progress to this more on ice activity. We had him doing some skill work with a skills coach. He was doing some return to skate groups. So we're just getting used to edges, turning corners, getting a little bit of speed going around objects, those kind of things. And then here's him all happy because he was able to skate for the first time. So again, then as we work into his return to performance stage, which is kind of where we're at now, unfortunately, again, we had some issues with hardware. His body just really did not want to accept what was in his body. So we removed some hardware. We had to backtrack back to that injury healing or that injury phase, pay attention to what some of those healing properties were like as he got his hardware removed and has a new scar, get him back into, jump back up to that return to sport and get him back into his skates. So then as we move forward into his return to performance plan, how are we monitoring his progress moving forward? Does his workload parameters line up with what the teams are going to be as we progress into preseason here? How are we planning to monitor his progress? Do we need to do any extra range of motion or prehab exercises with him? So these discussions are going to be had eventually. So I guess all of that to say, just a couple final tips. Speaking the same language is important. As athletic trainers and strength coaches, you should find that common language with each other, that common language when you're talking to the athlete and the coaches so that everybody's on the same page. Establishing those clear communication channels and having a process in place and a plan ahead of time so that if there is a differing of opinions or if there is something that you feel like you want to have a conversation about, that you know how to have it and when to have it. Be kind to each other. I know that sounds cheesy, but athletics is a grind. Athletic trainers and strength coaches, we're not in it for the money. So just be kind to each other. Learn from each other. I think that no matter how good you are at something or how good you think you are at something, no one can do this alone. And we can really find value from every single person's expertise. And again, putting the athlete first. That's what this is all about. Our athlete-centered care is important, and at the end of the day, they're the ones that matter. So thanks for listening. Here's my email and phone number if you have any further questions outside this small Q&A. Hopefully you don't feel like my daughter looks in this picture after this presentation and are excited to collaborate with your colleagues moving forward. And there's my cutie, Landon.
She's adorable. That's Macy.
Yeah, that's
Love
Macy.
it. I love it. Thank you so much, Jamie. This is fantastic.
Thanks.
Your experience and depth of knowledge really just comes out. So thank you for painting this picture for us. I'm going to take everyone off mute so they're allowed to unmute themselves. Please jump in and ask Jamie questions, or you can write them in the chat and I can get to those. But please feel free to jump in. And while I'm doing that, Jamie, I have to do it one by one. Can I ask you best practices for the communication between the AT and the S&C coach? Are you meeting? Do you meet face to face, or what's the communication like?
Yeah, so for me, like face-to-face communication, which is why this presentation was really weird for me just to talk to a screen at myself. But no, I think uh getting in the weight room as an athletic trainer, going to the lift, going to see and like communicate on a daily basis to them is really the easiest way. I do like a weekly like injury PDF format as well, just so that like if we have to reference back to where they were at that time period, it is nice to be able to reference back to. But for me, it's just figuring out, sitting down with your strength coach ahead of time, kind of learning a little bit about them and vice versa, learning about your athletic trainer so that you know how they respond best to communication. Some people might like a quick text, other people hate that and want a phone call, or maybe they're like, no, I need it on paper, right? That's how I can see it and organize it best. And I think we just have to adapt to what the communication style is best for that relationship.
But you showing up to the weight room, or even the strength coach showing up to the AT room,
Yeah,
uh, is I like kind of ideal, or
it is ideal. I
or
mean, maybe my strength coaches would argue otherwise that I work with. If you're on this call, I'm sorry if I annoy you, but I do enjoy being in the weight room. I have my CSCS. By no means does that make me a strength coach because I have not had like a period where I've done strength training with like a full team, but I like to learn and be in the weight room and help assist or maybe see like, hey, do you need help setting this up? Do you want me to help monitor this test, or I can do that? And it's just a good way to show face. And then vice versa. It's nice for the strength coach to pop by maybe if there's a rehab or walk an athlete down and say, hey, this guy just got hurt. I wanted to make sure he checked in with you, that kind of thing.
got it, got it. I have a ton of questions after that great presentation, but I don't want to be the only one talking. So again, please, um, all of the attendees, please unmute yourself if you'd like to jump in.
Hey, Landon, can I ask a question?
Yes, sir.
Hi, Jamie. My name's Andrew Reynolds. I'm a private sector strength and conditioning coach out of Columbus, Ohio. My background's in athletic training because I went to Ohio State and then was down at UNC Chapel Hill for the last 2 years. But one, thank you so much for your presentation. I think you did a really good job of, explaining, step one, that initial, response to trauma, response to the injury, all the way back to the return to play. It was kind of cool to see it, built out in that case study. My question for you is, I mean, this kind of piggybacks off of Landon. What's been the biggest barrier that you've had from communication, like with the strength coach or with, maybe a head coach? And then what have you done to kind of combat that and kind of come to a solution?
Yeah. Well, first off, thanks, Andrew. I'm assuming you know Kevin Lennon then. He
I
went to
do.
he
I
went
do
to
know
school
Kevin.
with me, so we're BFFs there. But that's a great question. I mean, there's always going to be conflict and there always is going to be barriers, but I'm a big believer that if you get ahead of it, so trying to have a plan in place, kind of like I talked about, and what your communication style is going to be before that happens is helpful. Now that doesn't always happen, and sometimes you'll have disagreements, but understanding the expertise of the professional. So like I said, like having some of this conversation with like a strength coach and your athletic trainer, or if like you work in a private sector now as a strength and conditioning specialist, bringing in other professionals to learn from, I think just helps us understand like where we're coming from better. And then once you know, like, oh, I know that he's really good at return to sprint because that's what he studied or did his master's on or did his whatever. I'm going to utilize that instead of trying to be like, well, I'm the rehab specialist here. I should be doing the return to sprint. So I just think finding that value and knowing their education expertise can solve a lot of those problems. That answer your question?
Yeah, awesome. That was great. Thank you so much.
I think you're on mute, Landon.
Thank you. I was just going to say, Jamie, what is the ideal or best practices that you would suggest for uh, the AT and strength coach sort of bringing in and working with some of the other stakeholders?
Well, one of the things that we have started to try and implement at St. Thomas is kind of just a support staff group. So a casual like get together over the lunch period once a month, or maybe you want to do it more or less, where we just kind of chat, whatever naturally comes up. Sometimes there'll be a plan, sometimes there won't. But having those touch points where it can be more of a casual conversation, I think allows opportunity for people to feel a little bit safer discussing those things. And then other stakeholders too, like not just strength and conditioning, but nutrition, sports psych. I'm trying to think of other ones, but they can all add value in some ways. So I think that natural way of conversation always good. Adding tidbits about like your family life or things like that. Other ways to do that, you can do it in like a more formal way. So our group, our athletic sports medicine group, we have once a month where each athletic trainer kind of speaks to our whole staff about something that is their interest, or maybe a case study or something they learned or expertise. So maybe you just gave me an idea. Maybe we can invite one of our strength coaches to give one of those talks. Or maybe we can have our dietitian come give one of those talks. So it's in a more formal setting. We can learn something. So I'm going to add that.
Awesome. Awesome. Thank you.
Yeah.
What other questions from our attendees? Did you step into St. Thomas and it's kind of because I know things work really smoothly there. Was that culture already there, or have you had to work with everyone to kind of bring about that culture?
I think a little bit of both. We have a unique situation where the strength coach, so we were Division 3 and moved to Division 1. So we had like a weird jump, which is abnormal. But the strength coach who is there for Division 3 is also an athletic trainer, and he moved back over to the dark side and is now the athletic trainer with us, and we have new strength coaches. So I think that already put a little bit of collaboration there to begin with, because we just have a staff that's very interested in strength and conditioning, or has had that experience there. But I do feel like we still have some work to do. There are some groups that may work better than others, and I think a lot of it has to do sometimes with the scheduling, or the amount of time that or interest somebody has. So I think we still have a lot of work to do on collaborating. I will also say that when I was at a previous institution, I did not have it as good, and there was only one strength coach for all the teams, which is hard but common in a Division 3 setting. And so having to learn, like, okay, I have to respect that he is dealing, or she is dealing with a million teams and I have 3. And so I have to, change perspective, change expectations, maybe offer to like help with certain things, and just utilizing resources a little differently at that level.
Got it. Thank you. Thank
Yeah.
you. That may be it for our questions. And so, Jamie, thank you a ton
Yeah, no
for
problem.
all of this information. We will make it available to all of the attendees and also those who were not able to attend. So we'll send out the recording link. And then thank you, Jamie, for this contact info.
Yeah.
So people can get a hold of you. Again, so much. We're so grateful for the time that you put into preparing this, and also for the great information.
Well, I appreciate being a part of it. I think it's always great. And hopefully those that didn't feel comfortable asking questions, or maybe you just want to email me and we can talk about ways that you make it work at your school, that would be fantastic. So I appreciate you having me.
Thank you, Jamie. Take care.
Thanks.